So, love with all your heart is the title of this talk, and I think it's a lot about me as a person. One thing is I've got a lot of love for the heart muscle. I think the heart muscle is phenomenal in its relentless ability to work, and yeah, that resonates with me every day of my life because I love some hard work. So, please enjoy, and let's welcome you to the world of biokinetics. Biokinetics is a profession that's originated in South Africa. The biokineticists on here, as well as myself, are extremely proud to be biokineticists. We've got a 4-year medical degree, either it's a 3+1 or a 4-year university degree. And we are registered with the Health Professional Council in South Africa and all medical insurances. In the UK, however, we are yet to be recognized as a profession. We are working extremely hard at getting recognition within the environment of medicine or the medical industry. And we've registered the Biokinetics Association of the United Kingdom, which we are very proud of. And please watch this space because it is developing. So the patients that we generally treat are the musculoskeletal patients, so patients with muscular joint injury, chronic diseases, neurological, respiratory, cardiac and circulatory. Today we're focusing on that, on the heart muscle. We do prescribe exercise for wellness, for sporting performance enhancement, as well as the special populations, of which is a great passion of mine. But today we focus on the heart. And the heart is a relentless beast. Every day it will, and I've got all the facts on this, which you'll really enjoy, but it will continue to beat without us being even conscious of it. And it is relentless in its work. And that is the thing that drives the blood flow around our systems and make sure that every cell within our body has got blood supply, oxygen and nutrients. So if you look at it in that capacity, it is absolutely unbelievable. And we're going to go into some anatomy just to get your brains really busy on what the internal aspect of the heart is behind that rib cage. It sits off to the left-hand side of your chest, just off the center. And why I've actually brought you this one is to show you these vessels, and those vessels that run along the heart muscle supply the actual muscle with blood. And that is a really important area of today's discussion. Those particular vessels are the ones that unfortunately get damaged. And those are the ones that we're going to try and protect forever. Okay. So as you can see, the heart is made up of an immense amount of anatomy. But for today's discussion, those vessels, the coronary arteries, are what we're going to be discussing most in depth. So when we look at the internal anatomy, we know that there's two atrium or atria, the right and the left side of the heart. And then there's two ventricles, the right and left ventricle. And the blood comes in from the body down into the right side, gets pumped out to the lungs, gets oxygenated, returns to the left side of the heart, and then pumped out of the left ventricle through the aorta and down into the system once more. And it is a fascinating tool that this heart is for us, because it just is, as I say, relentless in its work. So when we look at the electrical system of the heart, we're now looking at these yellow bits, and those yellow bits are the nerves that carry information down into the heart muscle during each beat. And what you might see is the electrical stimuluses that respond to that heart muscle are picked up via ECG. And this, on the left-hand side of your picture, shows you the P wave, which is the depolarization of the atria. You've then got a QRS complex, which is the ventricles that are contracting. And then the T wave is the repolarization of the ventricles. And that is a normal sinus rhythm ECG, okay? And what our clever doctors are able to do, and us biokineticists as well, but I'll just throw that in as a side note, we are able to interpret what these ECGs actually mean? And for now, we're only going to look at the sinus rhythm. I will be discussing different conditions whereby the heart is affected, but the ECG gives us a load of information. And that is when you go to the doctor, have little stickies placed on your chest in certain positions. That is what the doctor is actually looking at. And with the complexity of the heart muscle, unfortunately, that is where a lot of risk can also come for children that are not yet born, for fetuses, and then obviously later on in life, where age starts to kick in. And that is the unfortunate reality of age once more, and especially on the heart muscle. So we're going to go through some fascinating facts. You can head to the next slide. We're looking at the beautiful heart muscle. On the left-hand side is when the heart muscle is filling. So you can see that that valve is open, allowing blood flow down into that right ventricle. On the right-hand side picture, there's a contraction of that heart muscle, and that is pumping the blood flow out of the aorta and around the body. So it is just an incredible device. We're then looking at the interesting facts, and I think this is really fascinating for me. There are 10 facts for us to get through, so just let your mind just go wild. It is just unbelievable what this heart muscle does. How many times does a heart beat during the day? On average, an adult's heart beats 72 times a minute, which is 100,000 times a day, which is 36 million times a year. And all of us don't understand how that could be possible, but this is, on average, for the average lifetime, what occurs. What is the weight of the human heart? The healthy heart weighs 11 ounces on average, and pumps 2,000 gallons of blood through 60,000 miles of blood vessels. 60,000 miles. So if we could link every little vessel throughout your system, it would be the length of 60,000 miles worth of blood vessels. And this is mind-blowing. So just enjoy. This was the most enjoyable part of this talk, and it's just gone wrong, but it'll get right. How much energy does the human heart generate? And in a lifetime, the human heart has the power to create enough energy to drive a truck to the moon and back.
Wow.
So we have to give our hearts a little bit more respect, is actually what this talk is all about, because of its just purely unrelenting ability. So how does blood get distributed through the body? 5% goes to the heart, 20% goes to the brain and central nervous system, and 22% goes to the kidneys. So only 50-ish% plus percent goes to the working muscle. And that is amazing. How many cells receive blood? 75 trillion cells. It's a lot, yeah. Is the heart muscle the most powerful muscle in the human body? Yep, it is. It generates 2.5 gigajoules of energy. These things are incomprehensible. Which heart beats faster, man or woman? Throw it out there, guys, on in-house. Man or woman, which heart beats faster? Women's, yeah, women's heart beats faster because it's slightly smaller in relation to our body size. So it actually has to pump at a slightly faster rate, 78 beats versus 70 beats on the average. And that gets that gets blood around the system. So slightly faster for women. How fast does blood travel through the human body whilst resting? This is unbelievable. 6 seconds to go to the heart, from the heart to the lungs and back. 6 seconds. 8 seconds to get to your brain, and 16 seconds to reach your toes and travel all the way back to your heart. Amazing. And does lack of sleep affect the human heart? Yes. And this is one of our risk factors that we need to be conscious of. And these PVCs are when the heart is actually, an energized muscle. and it actually can beat by itself without the stimulus. So these are heartbeats that don't come via the nose, which is an amazing, amazing thing. Do all organs receive blood? Yes or no? Yes. However, there is one that doesn't, and that is the cornea. So the cornea is the only thing that does not have a blood supply in our system. So it gets its nutrients from tears. So a cornea is in our eye. Exactly. Yeah, good thinking. So in-house, we just said if there was a blood supply to the cornea, it may get in the way of sight, which is most probably why that exists. Amazing. Cool. So let's get on to the cardiovascular risk factors. And these are conditions and habits that increase risk of developing a disease. Okay, but the good news is that these can be controlled, treated, and modified. And this, if you haven't seen, is probably my most favorite slide because it explains so many things in one picture. We're looking at a gentleman by the name of Fred. He could be known as Francine or anything else. But we all know this gent, and we all actually need to learn from this gent. Okay, he is the one that is sitting back and watching sport on TV. He's got his cigarettes and his beer and his takeaway meals. He's bursting through his shirt. You can see that he might be carrying some stress, just a thought, but you can see he may be carrying some stress. And if you were to put a blood pressure cuff around his arm, you would anticipate high blood pressure. If you were to test his blood, you may consider high cholesterol levels or high glucose levels. And these are all the risk factors for cardiovascular disease. So this gent is 62 years old, which also puts him into the high age category for risk of heart disease. Okay, and let's go through those. So that one picture is one to stick in your mind. And there's a couple other things that I will particularly point out to you. So the non-modifiable risk factors, age is obviously one. And after 45 years for a gent and 55 for a lady, you are at risk of cardiovascular disease. Gender, men greater than women. However, deeper in the talk, I'll explain to you that women are also at risk. Genetics, our family history. So if we have had a cardiac event for mother, father, sister, brother of an age of 65 or younger as a male or 55 and younger as a female, that predisposes you to risk for cardiovascular disease. That does not mean that you are going to get cardiovascular disease. It just means that you are at higher risk. So it all comes down to your lifestyle choices that you make through your everyday living that will adjust whether these genes expose themselves as risk factors or not. Type 1 diabetes, difficult one, because often type 1 diabetes does occur within children of a younger age, and that definitely is a difficult one to modify, but that will be discussed deeper in our talk series, which is wonderful. And then ethnicity. So ethnicity of the Southern Asian groups and the Black African groups and Caribbean groups, they are unfortunately at greater risk of cardiovascular disease, but that doesn't diminish all of our risk as a population of cardiovascular disease. Modifiable risk factors, so high cholesterol and dyslipidemia. So it's when your cholesterol levels are out of ratio with one another, which we'll discuss. Hypertension and high blood pressure, type 2 diabetes or insulin resistance, smoking, obesity, which we are digging deep into this evening, and then a sedentary lifestyle. And that is where the biokineticist is really strong. We prescribe exercise that is for you. Good. Other risk factors are lack of sleep, sleep apnea and snoring, increases blood pressure because you're actually holding your breath. Pregnancy, preeclampsia, we don't know why that happens to some and doesn't happen to others, but it does put risk through the heart muscle. Being a woman, is actually a misconception. And in actual fact, cardiovascular disease is probably the leader in unfortunate death over any other conditions. So we really do need to keep in mind that cardiovascular disease is for gents as well as ladies. However, it is more for the gents. Then social isolation and interaction, mental health and stress. And those three definitely get flagged because in the research, these factors are becoming a much bigger risk factor for disease in general, just because we start to make skewed decisions if we are under a stress state. And those and those decisions are often for the things that aren't always for our best health. Example, excessive drinking, smoking, and pure loneliness. So those areas definitely need a lot more care. Great. So when we look at high cholesterol, on the right-hand side of your picture, you will see a normal blood vessel and then a blood vessel with fatty deposits. And those fatty deposits, that is where cholesterol starts to collect. But this fatty substance called cholesterol in our blood is actually generated by our liver. So yes, we all have cholesterol and it is very useful to us because all of our cells use it for fuel. But sometimes we actually exceed the balances of the good cholesterol versus the bad cholesterol. The good cholesterol being the high density lipoprotein, HDL, and that is actually a negative risk factor, which means if you've got a high HDL, your balance to your bad HDL becomes better. Therefore, it's actually good to have a high density lipoprotein. But if you've got excessive amounts of low density lipoprotein or non-HDL cholesterol, that puts you at greater risk of heart attack and stroke. I hope that makes sense because that is a little bit technical and hugely controversial in research as well as in practice, whereby the numbers start to rule how much cholesterol you should have, and that is up for debate, and it has been for many years. Then we look at hypertension. So what is blood pressure? So the pressure that we try to analyze is the systolic and the diastolic pressure. The systolic pressure is the pressure of the blood exiting the heart muscle under contraction, okay? And the diastolic pressure is the pressure of the vessels back at the heart whilst the heart is relaxing, okay? So what we are wanting is good pressure out of the heart and reduce resistance of those vessels. But you can understand that if those vessels start to clog, the pressure will then start to increase. And that is where risk lies. So our normal blood pressure is 120/80. And our high blood pressure is a reading of 140/90 and above. Okay. I encourage all of my patients to take a blood pressure diary. So you really want to be recording your blood pressure over time. And if you aren't monitoring your blood pressure, you actually don't know. So you need to monitor your blood pressure. So please speak to your medical professionals. Please speak to us biokineticists, and we're most happy to help you through blood pressure assessment. So what happens is that the increased pressure actually starts to damage those coronary arteries. So if you remember back to the beginning of the talk, when I started speaking of those arteries running along the heart muscle, those are the ones that get damaged. And those are the ones that start to. Giving up smoking is the best thing you can do for your health. However, if you do smoke, try and reduce. And ultimately, we all don't want to be smoking because there are toxins that get released by cigarette smoke that get into the blood and start to damage the muscles of the, start to damage the vessels of the heart muscle. So even if you've smoked for many years, stopping smoking or reducing the amount of smoking that you're doing will be most helpful in reducing your cardiovascular risk. Diabetes, this is when, so particularly type 2, when there is reduced amount of insulin within the system. The insulin is produced by the pancreas. And what happens is that if there's reduced insulin, there is an increase in the amount of sugar in your bloodstream, which starts to also damage inside or the endothelial wall of your heart arteries. And that puts greater risk. And that is going to be discussed in more detail in another talk. So when we're speaking of this endothelial wall being degraded or damaged, we're talking of a process called atherosclerosis. And this is when the heart muscle, as you can see there, the coronary arteries start to become blocked. And I'm going to show you a video just really quickly. It's a 1.5 minute video. I'm going to be doing the speaking. I won't be doing any of the singing or the music, but I will be doing the speaking of the video so that we can all understand what is going on. In-house, it's going to be a little bit challenging to see that video, so I'm most happy to take you through the video on at the end of the session, but online, please enjoy. Let's just get some technical skills done, which is obviously where I'm most strong. All right. So the British Heart Foundation, if you're looking for information on how you can take care of your heart, please go and visit that website. It is a gold mine of knowledge for heart health. So I'm going to be reading this along, so I hope it all works. Can you guys see it online okay? So your arteries are a system of tubes that transport blood around your body. Over time, the buildup of fatty material can damage and clog arteries, restricting the blood flow. This is known as atherosclerosis and can lead to heart attacks and strokes. There are several causes, including high cholesterol, which can clog up the arteries over time. High blood pressure, which damages your artery walls, making it easier for fatty material to build up on time. And smoking, where chemicals in tobacco smoke can also damage arteries, leading to this fatty material breakup. If the fatty deposit breaks down and ruptures, a clot will form, and this can block the artery. If this artery supply, I'm getting slow, there will be a heart attack, unfortunately, and if it's towards your brain, then we are at risk of a stroke, okay? And please support the British Heart Foundation because they're doing unbelievable work in their research. So the good news is something can be done to slow this process down. And that's what we're going to be discussing today. I hope that was interesting and I hope that kind of did the job. But seeing it in pictures is always a lot more interesting to do rather than actually just, you know, me trying to explain it. Do we have any questions at this stage? So yes, excess sugar does damage your arteries, and that is in our next month's talk. Yeah, in our next month's talk, we'll definitely be discussing that. But yes, the higher your blood glucose is, the more risk of damage to your heart coronary arteries. We've got one. Yeah.
When you have diabetes, obviously, what is the difference between the first and the second?
Wonderful question. So the difference between type 1 and type 2 diabetes, I'm just going to explain it in a sentence. One is you do not produce insulin, and 2 is you have reduced supply of insulin. Okay, but we will discuss that in way detail in next month's talk. Okay. Yes, Jill, we're going to do one question online and then we're going to get going with the rest.
Okay. Yeah, in the risk factors, there are certain things that you can organise, like if you drink and smoke, try to cut down. But then there are some that, for instance, I would have no control over. I've got mild sleep apnea, and hearing that that's a risk factor is actually making me anxious because I'm not bad enough that I need a machine. and I just have to live with it, and it affects my sleep, and that's another risk factor. So what about the things that you can't control?
Yeah, so okay, so sleep apnea is still one of our modifiable risk factors, Jill, and I think I'm most happy to discuss this in more detail, but in a nutshell, I would actually visit your doctor and ask if there is anything else that you could be doing to try and assist the airflow through the nostrils down into the lungs, because you want to reduce the amount of resistance of that air down into the lungs. So off the top of my head, and please, this isn't medical information right now, but you could use some of those nasal passage openers, or really get into the habit of making sure that the nasal passages are very well clear, so that airflow can be best. The other thing is changing sleep position. So there are certain things that we can do for almost anything to try and make things a little bit easier. I hope that helps.
It doesn't, and I won't take up your time, but sleep position, I have to sleep on my back because my fibromyalgia is too painful on my side. I won't go on because you've got a whole thing to do and you're doing a great job. But
yeah, for sure.
Yeah.
But I'm happy to discuss it at another time with pleasure.
Thanks, appreciate it.
With pleasure, with pleasure. Okay, great. So obesity, and this is potentially, yeah, I'll let the numbers speak for themselves. I think let's do it that way. I'll let the numbers speak for themselves, and we can discuss those numbers at the end. But living with excess weight or obesity can increase your risk of heart disease and heart attacks, strokes, and I've definitely highlighted there this vascular dementia. So by having decreased chance of blood flow to flow through our vessels, regardless of where they might be, there is a risk of all sorts of things going wrong, okay? And it is a little bit morbid at the moment, so don't worry about that. There is ways in which we can manage all these things, but we need to be aware of them. We can't put our heads in the sand. So when we look at obesity, according to the World Health Organization, it's an abnormal or excessive fat accumulation that presents risks to health. A body mass index, which is a skewed, however, very important and very useful tool, of over 25 can be considered for overweight, and over 30 is for obese. Okay, and that is your height. Excuse me, your BMI is your mass divided by your height squared. So you take your overall mass, you divide it by your height squared, and that will give you a value. And you're wanting that value to be below 25. However, when we look at the stats of 2016, because that's the most recent work, 1.9 billion people across the planet are overweight, and 650 million people are obese worldwide. Not only is that a health risk, but that is a huge financial burden. And that's where we need to talk, unfortunately. Policies need to change on a financial level to take care of our health. Rates continue to grow in adults and in children. Now, this one for me is the most alarming, and I think it's really important that we take this all in. From 1975 to 2016, the prevalence of overweight or obese children and adolescents between the ages of 5 and 19 has increased fourfold. So from 4% to 18% globally. Now, what has happened between 1975 and 2016? Screens have happened. Our children do no longer play in parks, they play on phones, and they play on computers, and they play on screens. And that is a big thing. The other one is commercialization of food, whereby at 1975, it was very logical to eat natural food. In 2016 and now 2022, you can get anything you want by the touch of a button on a screen. So you can sit all day long and eat whatever you like, and it all is money driven. So we really need to take these things to heart, shall we say. I'm going to continue here. We'll do a questioning at the end. So the COVID-19 pandemic statistics, and this is a really important one. So I'm not undermining COVID. COVID is extremely important. We got hold of. The world didn't actually know what COVID-19 was all about, and I think the drastic measures were important to take and put into place. However, there are 6.5 million deaths worldwide since the pandemic started up until now. Okay, and obesity is killing 4 million people per year. So obesity-related medical diseases is killing 4 million people per year across the world, and probably increasing. So we need to do something. As a human race, we really need to sit together, really work out how we actually are going to extend ourselves through our next generations. So when we bring it back to the UK, this is a really interesting one. 27th of July 2020 is when it was published, and it's tackling obesity. And tackling obesity is one of the greatest long-term health challenges this country faces. However, there are positive policy measures that are being put in place. I wouldn't say they are as drastic as required, but we have to all earn a living as well. So you can't exactly tell the cafe shop to close down because he only sells sweets and chips, because then his family will suffer. So you've got a very big logistical and economical nightmare on our hands, and it's only going to get at this stage worse. Today, around 2/3, 63% of adults are above weight. 63% of adults are above weight. So I don't know how to say it in any different terms, but this is what is published on the Governmental and World Health Organization. And we need to really take note of this. And of that 63%, then half of that is obese already. So above 30 on the scale of BMI. We need to take care. We'll do questions after. Okay, not a problem. And then 1 in 3 children, I return to the children once more, and this is where I'm most passionate, because all of us actually have the ability to learn these things. We have the ability to take care of ourselves, but our children coming out of primary school, 1 in 3 are overweight or living with obesity, and 1 in 5 have obesity. So we need to do a little bit for our children as well as ourselves. And why? As I'm going to just go through these a little bit quickly, but I'll give you some info on a couple of them. But there's so many reasons why obesity has become a huge problem. It's not as easy as eat less and run more. It's not as easy as that. That is very close-minded. There are so many factors that are influencing one individual and how they can make better decisions. And these factors: genetic, ethnicity, socioeconomic factors. The cost of healthy food is expensive. And that's a really important thing for us to realize, because even in the poorer communities, obesity is probably the leader of death, because healthy food is not actually as cheap as we all might think, and not as satisfactory. And that's the unfortunate reality that society has done to us. So lack of exercise and sedentary lifestyle, we've discussed that. The screen has come out, and the screen has destroyed our ability to move. When we look at diet, I will go into diet in a little bit more depth, but portion size and calorie content. So not only the amount that we eat, but what does that amount actually contain? Those are the things that we need to look into. Medical conditions and medications, we know that enhances obesity, stress and mental health. That is really the leader, I think. So others, Quitting smoking, people say they pick up weight by quitting smoking. Menopausal women in pregnancy, we understand the challenges of those, and that is a reality. We need to be sure to support our pregnant ladies after giving birth, as well as the middle-aged lady that needs our care in taking exercise as well as living a healthy life into account. Food advertising and commercialization, and this has now become a term, which is the obesogenic environment. And this is an environment that is conducive to weight gain at home and the workplace. And when we look at our big companies, yes, don't get me wrong, they are pushing really hard to get a more balanced lifestyle, we start to call it. However, many of our middle-aged workers are sitting at desks for 8 hours plus a day. Yes, we can try and influence those 8 hours. We can get standing desks and things like that, but I'm not too sure it's done on a big enough scale to make an influential difference. And the obesogenic environment, incredible. So we will get there. And on a physiological thing once more, and this just takes us through the excessive calories and why it's so challenging. We put strain on the pancreas. So the pancreas is the one that produces insulin. And if that strain is on the pancreas, not enough insulin is produced to take up the sugar into our blood, out of our bloodstream and into our working cells. And that increases the blood sugar level. And that blood sugar level is then higher as it goes through the coronary arteries, brain arteries, kidney arteries, every other artery that is small and delicate, and causes inflammation. And that inflammation then takes us through that process of atherosclerosis, which I tried to explain as best as I could. And that increases our risk of cardiovascular disease. So when we look at the picture of the obese population, we are looking at the apple shape and the pear shape. And the apple shape on the left-hand side of your picture is the picture that we are most concerned by because of something called visceral fat. And that is the fat that actually gets accumulated between our organs. So it actually reduces our organs' function. The subcutaneous fat that is generally around our hips and bums, that is less of a risk for cardiovascular disease. Okay, I won't go into that, but that is in measurement. So interventions, and this is where the magic lies. Healthy dietary habits, exercise prescription, and stress management. And it all sounds simple, but it's not. So we need to support one another through this process. And I'm not a dietitian, so I'm just going to touch on a couple things that will give you some information. Please do use our dietitians. They are well skilled in managing the way in which you like to eat, adapting a diet that will be beneficial to you and still fulfilling for you. So please do use our dietitians. So eating healthy foods, that makes perfect sense. I don't need to go through that. Reducing our salt intake, our saturated fats, and our saturated fats are the processed and meat fats that do accumulate carbohydrates, and then sugars. We need to cut down on our fizzy drinks, on our whatever contains a lot of sugar. And it might just start with stopping that chocolate in the evening. Just see how you feel by changing small habits. Reducing alcohol intake. It's a difficult one for us all. It is. Obviously, not drinking is the best. But when you look at the guidelines, you're looking at 14 units per week. So that is 6 pints per week, or I think it's 13 glasses per week, small glasses. Okay. And you can go out and you can have too many glasses of wine. And I understand how that can occur. What we don't need to do is do that every day. And that's where we need to make shifts. So alcohol-free days, meaning maybe drink on a Friday and Saturday if you want to have a sip of alcohol, and then maybe don't drink during the week, or however works for your lifestyle to be fulfilled by, a vice that you might need, but a responsible vice. Great. So when we get to exercise prescription, and I put it in a tablet form, because if we are to be prescribed medication by a doctor, by a medical professional, you are going to take it. And this is how I would really like our community to see exercise. Exercise is a dosage. It is important that we see it as a daily dosage of wellness. So by engaging in physical activity, you reduce your risk by 35%. 35%. It's a no-brainer not to move. If you're going to forget everything of what I've spoken, please do not forget the last point. Jamie, when you're ready. The last point is 150 minutes of exercise per week at a moderate intensity. Okay? 150 minutes is 2.5 hours. So if you put 2.5 hours into 7 times 24, it's very few minutes. Okay? And you've got 7 days worth of 24 hours to do 2.5 hours of exercise. So please be generous on giving yourself exercise. Please be generous, because the more of it you do at a moderate intensity, the more value lies in the exercise, and there's exponential value. So 150 minutes per week is the absolute minimum, and this we're trying to prescribe is actually one of our vital signs. So if you're looking at vital signs, you're looking at heart rate, blood pressure, cholesterol. Exercise should be one of our vital signs, whereby if you are not hitting 150 minutes a week, you're actually causing yourself harm. By doing a little bit more than what you generally do, you will be taking care of your wellness. And by doing a little bit more than that, you will be improving. Okay, so if you forget nothing, if you forget everything, please don't forget that. Okay, cool. I hope this is enjoyable for you all. Now, being active is the best things you can do, but that doesn't mean go to the gym, go run a marathon. There's no need for that. There is doing things that just get you busier. So you're breathing harder, you're feeling warmer, and you feel your heart beating faster. And something that brings you enjoyment, because the more you enjoy it, the more likely you are to do it. And I think that's what's been so successful about our classes online, is we all actually enjoy them. Yes, in-house, but during the pandemic, online. And the enjoyment is what we're after. So gardening, swimming, walking, playing with your grandchildren. But please try and accumulate 10 minutes at a time. Please don't do less than 10 minutes at a time. Okay? With the anticipation of getting a structure from a prescribed medical professional with regards to exercise. Yes, biokineticist. You are going to know about this name. The biokineticist is well skilled to prescribe exercise. So we're going to start with 10 minutes at a time in anticipation of building up to 30 minutes of exercise at a time. Okay? Frequency is always more important than duration and intensity. Great. Then we'll speak about questions at the end. We'll speak. Yep. Yeah. So stress management. We all feel stress, and stress isn't the thing that will lead to your cardiovascular disease. But if you are stressed, you're bound to make less healthy decisions. And that is the thing. So you're bound to eat more of the, the bad thing. You might smoke and maybe drink excessively. Okay. But really trying to manage our stress is, it's big. And we all struggle with it. So we've got to find tools that are going to help you. And the ones that I would like to leave you with is meditation, breathing exercises, physical exercise or movement, yoga, Pilates, if you enjoy that, and time with your friends and your loved ones. Isolation during this pandemic has really hurt us, and we need to re-engage with people as best as we can. because by spending time with loved ones in a happy sense can definitely reduce our stress. And the research is telling us that stress is probably the leader, if not all the other habits, but they lie hand in hand, of how we become more susceptible to disease. Because if we are at a stress state, our inflammation starts to increase, and our inflammation increases, which therefore makes us susceptible to atherosclerosis. Okay, I am conscious of the time, and I will be whizzing through the next little bit because I don't want to lose. So circulatory conditions happen in the heart, they happen in the brain, which we will be discussing in 2 months' time, and also through the limbs. These are different names of cardiovascular conditions. Angina is that pain in the chest that you might feel, and that needs you to act, because if you don't act, you are at further risk of an event occurring. So please do act if you are feeling that tightness in the chest. Okay, and there are all sorts of other electrical type heart conditions that affect the electric conduction through the heart, and then as well as the more physical things like valve replacements. Okay, so if you are holding on to these conditions, please do take care of them, and please do make exercise your #1 treatment tool in conjunction with medication and diet and stress management. So when we look at this picture, just so that we get a better understanding of this, on the right-hand side is the heart attack, which we've been discussing throughout tonight's session. That is when plaque builds up, closes the artery to the blood flow to the working heart muscle, which causes a blockage. And that heart muscle then is reduced of oxygen supply. And that is why it's so painful and so life-threatening. On the left-hand side is the electrical problem of cardiac arrest. And this is uncommon, but can occur. And this is when the heart muscle stops. And that is when you need that defibrillator to rewire the heart muscle, okay, and get the heart muscle pumping again. It doesn't happen frequently. It's less than 1 in 50,000 people that do experience this, but it is an important thing to realize that there's a difference between a heart attack and a cardiac arrest. A cardiac arrest is the electrics, when you would speak to the electrician, and a heart attack is when you speak to the plumber, okay, because that is all about the tubes of the heart. Great. So treatment options. These are doctors' treatment options. I'm not going to go into depth in this just because of time, but there are some very, very scientific and very powerful medical treatments that can make these heart muscles that are at risk into much better states, okay? And then we look at the treatment of the heart attack, which I just want to touch on. This is what a stent is. So it's called a coronary angioplasty. They go in through the groin vessel up to the heart muscle with a catheter, unbelievable in itself. They put in a little balloon and a little cage. They then blow up the balloon. The cage then holds in position. They pull the balloon out, pull the catheter out, and you've got a nice open vessel with a cage that is holding that vessel open. And that, the cage is actually what the stent is. So just an interesting one. And then we look at the bypass. And the bypass is when we take vessels from other areas of the body and take them from the aorta, which is high oxygenated blood, bypass where the blockage is, place that to where the vessel then can be supplied with blood so that that heart muscle that didn't originally receive blood because of blockage can now be recapillarized. Interesting, okay? And that is taken out of the chest, the mammary artery, or the legs, the peripheral veins, which is absolutely amazing. Cardiac rehabilitation, and I've had the privilege in my career of working with many patients with cardiovascular disease, from the worst of it, like heart transplants and things like that, right up until, you know, the general busy businessman that just feels like he's invincible, but every now and then feels chest pain. So there's a scale of cardiovascular rehabilitation. But the principles of it are really important for me to discuss, and why it is important to engage with a cardiac rehab program after a cardiac event. And education is probably your biggest tool. And that is what we're doing tonight. We are discussing these things so that we can understand them better so that we can act. If we don't take the time to learn, we'll never actually change. Okay, so education is the biggest thing. The rehabilitation process obviously allows for recovery, allows you to make changes to your lifestyle for a more healthy heart, reducing your risk of further problems. And that's the unfortunate thing of our system, is if there is an original problem, that is our weak link, if you want to call it. And that makes us at risk of similar problems or other problems within the same area. So we really do need to take care once there is an original problem. And the psychological aspects, again, cannot be undermined, because we lose confidence in our bodies after a cardiac event. And one way in which to regain that confidence is through a well-structured cardiac rehabilitation program. So it is patient-centered. It is with a multidisciplinary team, the cardiologist, the biokineticist, the physiotherapist, all the nurses, and everyone else really needs to be on the same page with regards to this patient, so that we all understand what the patient is going through and understand the patient's case best for best possible results. So then an ECG is done, a stress ECG, to find out where the heart rate limits might lie. So there is also risk at the high end of exercise after cardiac events. So we find where those limits might lie and gain clearance for exercise. And then using a medical professional is really important, because then there's constant monitoring so that you can learn how your body responds to exercise with the help of a professional. Benefits on the physiological level, you increase the heart muscle efficiency. And that is the whole point. The heart's been through trauma, and it is a muscle. We need to give it the chance to recover, okay? You then increase the amount of blood flow to that affected area through training. And the psychological, once again, cannot be undermined, because we all want everyone to be living happier, healthier, longer lives. So the phases of cardiac rehab, phase one is in hospital. That's the really scary times when you're coming through out of surgery or out of a cardiac event. The phase two is outpatient of 6 weeks to 12 weeks. And that is where we get mobility in to try and accept normal activities of daily living. Phase three is where the biokineticist fits best, where we have our most strongest knowledge. And that is from about week 12 to 6 months, whereby you increase the intensity of what the cardiac patient can achieve to be able to finally get to the maintenance phase, which is phase four, whereby they are living healthier lives. In private medical biokinetics practice, I'm really proud to be a biokineticist in the UK, even though we are small fry in the greater good of the UK, but we pack a punch. As I said in the past, and I will say again, I'm extremely proud to be a biokineticist. I've been doing this for a couple of years now. I work out of Anytime Fitness in Fulham and at Until in Soho. I do face-to-face as well as online treatments and online classes. I'm associated to those associations, of which the Biokinetics Association of the United Kingdom is closest to my heart, but it really is important that us biokineticists get some sort of recognition within the biokinetics medical environment. And I hope this talk gives the biokineticist a little bit more credibility in what we know about cardiovascular disease and how we can make patients better. At Fulham Good Neighbours, I have the privilege of meeting the classes 3 times a week. So Jamie, once again, thank you so much for hosting. Thank you so much for just taking my skills on board within your facility. And thank you mostly to the members of our classes, because these members are the most important things of why I do what I do. So thank you all for enjoying the classes so much, and everyone is welcome. So there are the references of today's talk. I know I've gone a couple minutes over. I hope you all have enjoyed it. Next slide, please. So love your heart is what I leave you with. Okay. And I also leave you all with lots of love and thanks for using your time on being here. And I'm happy to receive any questions. So thank you so much.